This is an application video for the Pelvic Sling from VBM. The Pelvic Sling is a non-invasive external pelvic stabilizer for compression and stabilization of unstable pelvic fractures. The Pelvic Sling is packed in a compact size bag, ready for use. The cuffs are inflated and deflated with the hand inflator. It can be removed for use in MRI. The stopcock serves for a leak-free transport. The manometer for a visual pressure control. The slide splint facilitates the guidance of the pelvic sling underneath the patient's pelvis. After placement of the pelvic sling, it can be used as a knee fixation to maintain the internal rotation of the lower extremities. Remove all objects from the patient's pockets in the area of the pelvis. Choose the correct size. Slide the pelvic sling with the help of the slide splint underneath the patient into position. An assistant can help and lift the pelvis carefully. The printing inside must face to the patient. Afterwards, remove the slide splint. Place the pelvic sling so that the lateral cuffs are positioned centrally on the trochanter major. The cuff markings should be equally visible on the left and right side. Close the pelvic sling similar to a belt. Slide the fixation tape through the buckle and pull it slightly. The pelvic sling must be fitted tightly to the patient's body, but without changing the position of the pelvis. Connect the hand inflator to the pelvic sling. Inflate the pelvic sling with the hand inflator to the beginning of the green zone of the manometer. A pressure increase can lead to a further significant reduction of the intrapelvic volume. The required pressure increase is at the discretion of the user, but should not exceed the green zone of the manometer. After inflation, close and turn the stopcock to the closed position. Ensure that the cuffs are inflated adequately during transport. Check the cuff pressure on the manometer. If required, stabilize the knees by means of the slide splint to maintain the internal rotation of the lower extremities. For X-ray, CT, and MRI, the hand inflator must be removed from the pelvic sling, as it could cause artifacts around the area where it is positioned. Remove the hand inflator with the stopcock in the closed position. Prior to the removal of the pelvic sling, a surgical stabilization of the pelvis must be guaranteed.